Hello and welcome to this edition of City Hall Insider. I'm Jim Marshall of the New Bedford Cable Network, and joining me again, still, as usual, Damon Chaplin, my friend, the health director for the city of New Bedford. Thanks for coming in. On short notice, I might say.
Thanks for having me. Anytime for you, Jim.
I was looking back, and I told you off camera moments ago, we did this a year ago. We're heading into the holiday season, and I know it's a wonderful time for folks. And we talked a half hour last year at this time. Sort of give, and I've always asked people, and I know you always get this question at the start, where do we stand right now as we head into this holiday season?
We're at a place where we're seeing an uptick in positive cases, statewide and regionally, even in New Bedford as well. And so the message pretty clearly to folks is that if you are eligible for a booster shot, get your booster shot. If you're not eligible for a booster shot and you haven't gotten your first shot, get your first shot. If you're in need of a second shot, get your second shot. And if you haven't gotten your vaccine, get your vaccine. And if you don't have a vaccine, get tested. And if you haven't gotten tested and you don't have your vaccine and you haven't gotten your booster shot, then be very selective about your activities during the holiday season.
I was asking you off camera a question. Are you surprised that we're 19, 20 months into this and we're still talking about this? This still dominates our conversations?
No, not really. Like other infectious diseases, COVID has a seasonality to it. This is a season where in the Northeast people come indoors and we tend to see an increase in infection rates. And so, we're better than we were last year. But we're still seeing a significant increase all throughout the state and in the particular region. So.
Yeah, regionally, I just saw moments ago the numbers 59% increase in the last 2 weeks just in the Northeast, in New England actually, specifically they said.
Yeah. Last year we saw a similar trend in early November leading up to the holidays as we see people starting to travel. The best recommendation we can give is to get vaccinated. That's the best thing we can do to protect ourselves, our families, and our communities at this point.
We're in a different place, though, aren't we, from a year ago? I mean, when we were in here a year ago, obviously you were getting information out, but it seems because of the vaccines, we are at least in a different place.
Yeah, we're at a space of our personal choice right now, Jim. With people, if you want a vaccine, you can get a vaccine. And so it's really about personal decisions at this point. And it's about individuals making decisions for themselves and their families. We continue to provide information, education. We continue to do outreach, and we continue to provide vaccines at a very high level in and around the city. And so it's really about people making that final choice to get vaccinated. So it's, how do we get to that tipping point? That's the $1 million question.
Yeah.
What is that one thing that's going to cause a person to change their mind or to reflect differently about the vaccine? So,
have the reasons changed for people's reluctance that you found?
No, I think we've hit a segment of the community where they're dug in pretty deep, and so. What we're hearing, though, anecdotally within the community is that, people are seeing other people that they care about become significantly infected. And that seems to be a trend of change, where people are beginning to think twice about their decisions around the vaccine. So,
you've been doing so much outreach. You've been here at Cable Access talking about it. I know you've been on radio and talking on TV. You've done so much outreach. Is there, I guess, any other way to get to the people to tell them about the importance of the vaccines that you think you haven't done yet, or?
No, I care. I care about each and every one of them, regardless of what their vaccination status is. That doesn't matter to me. What matters to me is that we engage, that we're being compassionate, and that we care, and that we're creating opportunities for folks to do what they feel as though is the right thing. It's important to me that we respect decision, we respect personal choice. I understand that their choices are affecting other people at a pretty large clip. But it's important that we have to maintain some space where folks can have time to heal and to kind of contemplate amongst themselves about the decision. And again, at the end of the day, this is their body, and so we want them to make the right choice. For me, that would be to get vaccinated, but we want to be respectful.
You were talking about off camera, you in the healthcare industry, in a sense, are looking at things differently now, in a sense where you're looking at hospitalizations and the number of people because people who have taken the vaccines, I mean, the hospitalizations are lessened. I don't know if the numbers are lessened, but the severity of people who are vaccinated is lessened, right?
Yeah, so the things that we're looking at now, the key indicators now versus what we were looking at a year ago, we're looking at breakthrough rates, which is about 1.6 for New Bedford and about 1.3 for the state, meaning that the number of people that have been vaccinated that are still becoming infected. So we're looking at about 1.6%. And then also at the hospital, we're looking at obviously hospitalization rates and then also mortality rates. And so those mortality rates have been relatively flat or have declined. And the hospitalization rates, they've kind of moved with the level of positive cases. And so we've saw them come up and go down, but they're nowhere near where we were a year ago this time. Yeah.
And the one thing, I mean, I know people who have had a breakthrough case, but the people who have had it said it just feels like the flu. Whereas if you're unvaccinated, it may not feel like the flu. It may be worse than the flu. And I guess that's the goal, because the vaccines never were 100% preventative. I mean, that was said right from the start.
Yeah, it's designed to reduce mortality from the disease and reduce hospitalization. And so we want people to be able to heal at home. And so for what we've seen with the numbers, it's doing its job. We just need more people to get the vaccine.
How is a couple quick questions, children 5 and 11 and what have you, how is that going in New Bedford?
Yeah, the vaccination rates for them are similar to what we're seeing with the adults. They're somewhat depressed, but that can be expected. When we have parents who are reluctant to get the vaccine, it's going to translate into kids who are probably not going to be vaccinated as well. And so our 5 to 11-year-olds, the numbers are a little bit lower than we'd like them to be. And so we're really working very closely with the school departments and our community groups to set up, what we consider depot clinics, where we're offering J&J, Pfizer, and Moderna, and PD Pfizer for kids 5 to 11.
How about booster shots for those that, because now the state allows any adult, I believe 18 and older, to get it, correct?
Yep.
I don't know if it's 12 or 18. It's 18, right?
Yeah.
Yeah.
If you're, more than 6 months outside of your original vaccination, we recommend that you consider a booster shot. Most of the clinics, if not all of the clinics that we provide in the city, they're depot locations, so you're able to get a booster, a pediatric vaccine, or a Johnson & Johnson vaccine, whatever you choose.
I was asking you about the mix and match. I know I, for one, have I took the Johnson & Johnson at the McCoy Rec Center. That was offered that day. But you're okay with the mix and match?
Yeah, I follow the guidance of CDC, and whatever they recommend is kind of what we follow here. If you have gotten the Johnson & Johnson and you want to get a Moderna as a booster shot, we have those available for you as well.
So we've got another 5 weeks here or so of holidays with Christmas and New Year's and the like. Just your word of caution for folks as they get together at these family gatherings. It's going to be different than last year, when I think people did a good job of being selective, but I know the pent-up demand just to get out and meet people's got to be huge this year.
Yeah, it's the best thing I can say to you is that work within your cycle of vaccination. If you have gotten vaccine and you qualify to get a booster shot, get your booster shot. If you are within your series of first and second shots, make sure you get your second shot. If you haven't gotten a vaccine, a first shot is better than no shot. And if you haven't gotten a vaccine at all, make sure you get tested before you get a test as soon as possible between, the time that you're going to be engaging with the rest of your family. And if you can't do any of that, make sure you wear your masks, make sure you wash your hands, and you practice responsible social distancing.
And the city has a lot of clinics available to them that they could get the vaccines. You check the website, the city's website, and your website, I would imagine.
Yeah, outside of the holiday season, this particular week, we have pretty much clinics running almost every day of the week at a different location. You can check the city's website or the state's website to get a schedule of the vaccines that we offer here in the city.
And testing for people who are still reluctant to get it, they should at least get themselves tested to make sure that they're okay.
Absolutely. We've actually added an extra day at the airport, and so you're able to get tested tomorrow at the airport, the New Bedford airport. So we will maintain testing capacity through the first of the year, possibly through the spring as well. And so, if you haven't if you're traveling and you're not vaccinated, please, do what you can to get tested to make sure that you're not posing a threat to yourself or your family.
You're an optimistic person, one of the most optimistic people I've met since we've been working together. How are you looking at this holiday season compared to last? Feeling better about it?
Yeah, I am. I think we've had an opportunity to get more information out. We've had an opportunity to set up even more systems that we didn't even have last year, meaning the vaccine clinics. We have the ability to go to people's homes to get them vaccinated, which we really didn't have up and running last spring. And so we have a ton more resources, a ton more systems set up, and we've done a lot more education and outreach. So yeah, I'm feeling very optimistic. We just want people to make the right choice and get vaccinated.
I'd be remiss if I didn't ask, and I just thought of this now, but flu season's upon us too, and I know that about this time of year you and I are always talking about flu shots.
Yep.
That hasn't gone away either yet, though.
Yeah, and particularly for those families who have kids that have upper respiratory conditions, get your flu shot if you can, as soon as you can. We're seeing that there's folks that are getting their COVID vaccines, but they're foregoing their normal flu shots. And so we would strongly recommend that if you have kids or family members that have, specifically if they have upper respiratory conditions, to really consider getting the flu shot as well.
If you have a COVID shot, do you need the flu shot?
Yes,
okay.
You do. There are some, when you enhance your immune system with any vaccine, it's gonna increase your immune system, but it's always best to get the appropriate vaccine for the season.
It's good seeing you. Enjoy the holidays.
Man, Jim, thank you, man. I appreciate you, man. What are you cooking for Thanksgiving, man?
Nothing really. My wife keeps me out of the kitchen.
All right. Well, good seeing you, man, and thank you again.
That's Damon Chaplin. He's the city's health director. He's been doing a great job all year. I'm Jim Marshall, the New Bedford Cable Network. Thanks for watching. We'll talk to you again soon.